Having a private hospital or a nursing home in Nigeria is one of the most profitable business for medical practitioners or nurses who are willing to establish their own hospital or nursing home. This is because there are over 200 million population in Nigeria, and we do not have sufficient health care to care for this 200 million population. As a matter of fact, taking a place like Lagos, for example, where you have maximum of 2 general hospitals in a population of over 3 million. Lagos State as a metropolitan city have over 22 million population, and not all of this local government has a general hospital. As a matter of fact, some of these general hospitals are overpopulated and there is no enough bed space. The primary healthcare centers in the states, we do not even have doctors there, and most of them do not even have nurses. Most people in Lagos prefer going to private hospital. And do we agree with me that we do not have sufficient private hospital to care for this population? So, if you are a nurse or you are a doctor, you can establish your own hospital in Nigeria. With as little as 1 million naira, you too can have your own private hospital. How can you go about it? How do you want to go about it? In this video, I will be sharing with you how I was able to establish my own private hospital with just 500,000 naira. Good afternoon and welcome to my YouTube channel. My name is Osage Mary. Today we'll be talking about how to establish your own hospital in Nigeria. This video is also useful for people who are outside Nigeria if they want to invest in healthcare in Nigeria as well. I'm privileged to talk about this video because of my experience in establishing an hospital. In 2016, I set up Mondesi Hospital, which is now known as Vic Mary Intercontinental Hospital. This hospital was set up in Ikorodu, and the hospital has been running for over 4 years and still running. Now, I'm going to share this video because of my experience and how I was able to start this hospital. Many nurses do not know that with their license as a nurse or with their license as a midwife, they have been given the power to establish their own nursing home or maternity center. Hospital is a very profiting business in Nigeria. As a matter of fact, if you want to establish an hospital as a nurse, you will need the certificate of a doctor or you will need a license of a doctor. In my case, I have to use my friend's certificate to establish my own hospital. But let's talk about establishing the nursing home, because there's a difference between a nursing home and an hospital, or a maternity home and an hospital. In nursing home, you are not allowed to do surgery. You are not allowed to take delivery, but you can do every other thing. You can treat all kinds of ailments. Meanwhile, in an hospital, you can do anything that you want to do. So I prefer setting up an hospital than being limited. However, there are laws now that requiring nurses in Nigeria to start taking delivery in nursing home because they were trained to take delivery. But that is not the issue of today. I want to let you know that this channel is going to open your eyes on how you can establish your own nursing home and maternity home with just 1 million naira. In 2016, when I started my own hospital, I started with just 500,000 naira. Many people can attest to this, but things are expensive now. Economies have skyrocketed, and things are very unpredictable. So I would say with 1.5 million naira, you can establish your own nursing home with ease. However, this video, please don't forget to subscribe. Don't forget to like this video. Don't forget to share with your friends if this video is helpful to you. My name is Osage Mary, and don't forget to turn on the notification because I will be posting more videos on this channel. Now, as a nurse, as a registered nurse in Nigeria, or as a registered midwife, your license given to you by the Nursing and Midwifery Council of Nigeria has given you the right and privilege to establish your own nursing home or to establish your own maternity home as a midwife. Not many nurses know this. I mean, I was once in your shoe. But a few years ago, as far back as 2016, 2017, I was able to establish my own hospital as a nurse. What did I do? The first thing first you need to know about establishing an hospital is to have a passion to care for people who are sick. If you do not have a passion to care for people who are sick, definitely you are not going to receive the reward, because passion have to follow profit. The first thing you need to do before you establish your own hospital is to have a substantial savings. And one of the things I always recommend for people is, while you are planning to set up your own hospital, start buying the equipment little by little. For me, I started by buying autoclave. I bought autoclave 100,000 naira. I bought stethoscope about 10,000 naira. I bought suctioning machine. I bought refrigerator to refrigerate my vaccines. And then I bought surgical pack. I bought delivery pack. I bought stationaries. I was buying this item and I was keeping it in my room. And then I paid for hospital beds, and I was not having the money to buy delivery bed and all of that. So when you have bought all these things and keep, the next thing you need to do is to look for a perfect location. The one important thing about establishing an hospital is to have a perfect location, because the location that you put your hospital is going to determine how much profit and success that hospital is going to have. Now, there's difference between how to establish an hospital and how to manage an hospital. But in establishing an hospital, location is very important. If you want to establish your hospital in Lagos, for instance, you need to decide if the hospital will be in Ikorodu Axis, or it will be in Surulere Axis, or it will be in Aja Axis, or the hospital is going to be in Iyanakpaja Axis. Whatever location that you choose, make sure that the hospital is not close to a fast-growing hospital that has been there for years, because you don't want competition. You want to establish your hospital in a new vicinity where there is no private hospital there before. You want to make sure that your hospital is established in a place that you are not in a competition with any hospital that you meet there. Don't ever make that mistake to establish your hospital close to a general hospital, because the general hospital are going to be at your neck. Ministry of Health is going to be disturbing you to pack up, because you establishing your hospital close to a general hospital is unacceptable. Now, the next thing you need to know when it comes to location is, do not establish your hospital in a market square, because hospital is supposed to have 24 hours access. You are there to make profit. When the market close, everybody goes home. Nobody go to patronize you. Clinic is better set up in the market square. In another day, I'll talk about establishing a clinic. Hospital is better set up. Hospital or nursing home is better set up in a residential area. Now, to set up there's difference between a nursing home and an hospital. The difference is that for a nursing home, it is established by a doctor. For a nursing home, it is established by nurses or midwife. It is not the duty of a doctor to set up an hospital, to set up a nursing home or a maternity home. Now, if you want to set up an hospital as a nurse, you are going to need the certificate of a doctor, or you have to employ a doctor. But you don't need a doctor, or you don't need a doctor when you want to set up a nursing home or a maternity home. Now, after you have looked for a location, you get your you have to look for a 4-bedroom flat or a 5-bedroom flat. This is because you have to have one room for male, you have to have one room for females, and then you have to have one room for where you'll be doing your treatment and all of that. Then you have to have a separate corner where you'll be putting your medications, drugs, which is known as dispensary or pharmacy. Another thing you have to also plan for is to register. Because you are a nurse, because you are a midwife, you don't really have any problem with registration. For Lagos, to register your nursing home or maternity home in Lagos, you have to go and pick a form in Alausa. I don't know any. Alausa is Ministry of Health. If you go to pick a form in Alausa Secretariat, the form is about 10,000 naira or 11,000 naira. I don't know if they have increased the price now. If you go to pick the form as a nurse or as a midwife, they are going to give you the form for you to fill. Now, when you fill this form, you have about 2 months for you to return it. And then they will come and inspect it. You have to make sure that you use a qualified staff. As you all know, in Nigeria, it's 1 nurse to 5 patients. So if you are working in a nursing home, you have to make sure that the registered nurse is always on duty, because you don't know when the Ministry of Health are going to come to inspect your place. So if you pick this form, you will see the requirement there the requirement for the registration, which I know is something you can provide. It's basically your qualification, the number of staff you have, the picture of the building that you are using, and all of that. Now, talking about after registration, you have to see also talk about employing staff and how you are going to pay salaries. I know that is another video entirely. Don't forget to subscribe. Don't forget to like this video. Don't forget to share. Don't forget to also inform your friends about this YouTube channel. My name is Osage Mary.